Tricia.
Hey, Stephanie.
Thanks for talking with us today.
This is going to be fun.
So first of all, tell us a little bit about where you work.
I work at the Maryland Archaeological Conservation Lab, and that's located at Jefferson Patterson Park and Museum. And we are the state's research, conservation, and curation center for archaeology for the state of Maryland. And we have currently got about 10 million archaeological artifacts from all over the state that we curate and make available for researchers and the public.
So what is your favorite thing about your job?
I love the opportunities to work with all of those artifacts and to use them to help create identification and dating tools that can be used both by other archaeologists and by the public in helping them learn about the past. And that's really one of my favorite parts of the job, plus working with the public and helping them understand archaeology and why it's important.
Yeah, you all have an amazing public archaeology program down there at the MAC Lab. Well, why don't you tell us about how you got into archaeology and what has kept you in it all these years?
So I think it's sort of an odd story that goes all the way back to when I was very, very young. I was introduced to a book series called The Boxcar Children. And in the first one, these children, these brothers and sisters, are orphans, and they find a boxcar. They're running away from the orphanage, and they find a boxcar in the woods that they're living in, and they have to furnish their boxcar, and they find a trash dump in the woods, and they dig in it and find all of the things that they need, the plates and the dishes and the cooking pots and stuff. So that idea of finding things, number one, just really, really intrigued me and got me thinking about, finding things from the past and using them in various ways. And then I went to undergraduate at William & Mary, and they had an amazing anthropology program with a focus in historical archaeology. And that, plus the Colonial Williamsburg Foundation and all of the archaeology going on there, it just had me hooked. And what keeps me in it, I guess, is learning about the past and trying to understand people from the past and why they did things the way they did, and then helping other people get excited about archaeology in the past.
So to that point, why don't you talk a little bit about your Maryland Archaeology Month topic? What did you write your essay on?
So I read my essay about a clinic, a medical clinic in Baltimore. So there was this great site that was dug in 1980 called the Federal Reserve site, where the Federal Reserve Bank is located today. And it's down near Camden Yards in the Inner Harbor. And they discovered lots and lots of privies and cellars and all kinds of features from the late 18th all the way through the 20th century. And there was a privy that was filled between around 1850 and 1870 that had a lot of medical equipment in it. And so I started doing some research and found out that this was the location of something called the Southern Dispensary, which was essentially, they supplied medicine and medical care for citizens of the city that couldn't really afford to pay for medical services. And these dispensaries were funded by charitable donations and from taxes that were gathered on bars and houses of ill repute. So they were much more common in the 19th and early 20th centuries, but today, a comparison today would be a subsidized free clinic that you find in some urban areas. This Southern Dispensary opened in 1847 and was in business until at least 1889. And the medical pieces that we found included a simple microscope, pieces of something that was most likely a stethoscope. There was a big mortar, like a mortar and pestle for grinding medication, making medicines. There was a pill tile, which was used as a little flat ceramic piece that was used to help roll pills, which was a very labor-intensive process until pill rolling machines were developed and became automated. There were a lot of large medicine bottles too for treating illnesses, for things like gout or tuberculosis, and some other illnesses that are not as familiar to us today, or at least the names that they used in the 1850s to 70s.
That sounds fascinating. A real treasure trove. I've often said, you'll never find someone more excited about looking in a privy than an archaeologist.
Privies are great, man.
So, given the situation we're in, the COVID-19 pandemic, do you see parallels to what's happening today? How is your research relevant?
Well, I think that this privy and the dispensary and the services that it provided are really physical evidence of an early public health facility. And with large populations that live in cities, it was really critical to provide medical service. And in Baltimore, at various times during the 18th and 19th centuries, they were hit with numerous incidences of infectious diseases like tuberculosis, cholera, yellow fever, and smallpox. So clinics like the Southern Dispensary really played a critical role in helping treat infected individuals and preventing the spread of infectious diseases. So the importance of public health and the dissemination of information to people to help them from getting sick in the first place and then treating them once they are sick has been particularly crucial over this last year, as we really all seek how to best protect ourselves and our loved ones from getting this disease. So that's sort of the tie-in I found.
So, speaking of friends and loved ones, this is our last question. What is the first thing you want to do once all of this is over, once the pandemic is over?
So I know everybody's saying travel, probably, because I think that's the thing most people are probably most excited about. Right before the pandemic struck, I had a big screen porch put on the back of my house, and I would like to kind of initiate it by having a porch party, a big porch party, once all of this is over with. So I think that's one of the first things to go try to do once the weather gets warm and we get kind of beyond this.
Well, that sounds fantastic. And I hope you and I get to see each other in person this year.
I hope so too.
Well, thanks so much for talking with us today, Tricia.
Thank you guys for doing this. This is fun.